I was born in Bogota, Colombia, just a little different. So I grew up in Virginia and did my undergraduate training in Virginia Tech. Then I went to MCV, Medical College of Virginia, and did my medical school and residency there. Went to Florida and practiced in private practice before coming to Wilmington. I think it was a little combination of things. I had a great pediatrician growing up, and I just thought, wow, what a wonderful thing to do. If you get one shot in this world, you can impact people's health. And everybody loved the pediatrician. I thought he was great. He had a great personality. It made me feel really comfortable. And I thought that was just, seemed like a really noble career. And I'd be happy with myself at the end of the day. And I loved the diversity that was associated with women's health. We build relationships with these women because we are in a unique position to affect their healthcare through a lifespan of people. We build relationships. They entrust us with their secrets and their fears and their celebrations. We can bring life into this world, and then we can help them make some long-term health decisions. So I really was very attracted to that part of it. Probably the most important thing that we can do in women's health to keep women healthy from teens through menopause and through end-of-life issues is empowering women through education. So a lot of what we do throughout different stages educating women. Most people think that as physicians we're prioritizing women's health through regular doctor's visits and maintaining health and healthy diet and healthy exercise, prioritizing mental health. And that certainly is true, but because we touch women's lives from early on throughout the decades, we can look at other social determinants of women's health, and we have the ability to intervene, whether it's education and encouraging them, income, employment. We know that connectivity in the community is important, safety for our patients. So we can address all those concerns, and we can also take a look at relationships and all those social determinants, like I said, to help empower women. And even if we don't directly affect them, we can educate them about how that affects them and connect them with community services. So when a patient comes to me for the first time, that visit is usually me getting to know them a little bit. Like I said, we build relationships with patients. It's not just a problem visit, see you later. We expect to have them coming back. So we want to know who they are, who lives with them, what they're about. And so a lot of it is information gathering on our part, and then figuring out if we are just maintaining health at this standpoint and educating them, or if there are problems and identifying them early on to help them, like I said, make good decisions and help us make good decisions for them. And we have a vast array of services for them and love to talk about everything from helping them be healthy to getting pregnant, delivering babies. We have the unique privilege to be in the room with them, and they share these things with us, to things that are more serious, whether they need surgery. What can we offer them from a minimally invasive surgery standpoint, and what their best options are. I think I want them to come away from the visit knowing that I'm a partner with them, that their involvement is really important, and I want them engaged and active in their health. They see me once, sometimes more often a year, and I'm going to help coach them along and educate them, but ultimately it needs to be in their hands and we're partners together. When I'm not at work, I enjoy being with my kids, exercise, being with my family, and we live at the beach, so I love anything else outdoors.